Hi, I'm Kimberly Sims, student practical nurse at Antonelli College. I'm here to talk about childhood cancer, specifically acute lymphoblastic leukemia, also known as ALL, for parents who may be dealing with this disease. At the end of the presentation, Ms. Dawn Harris, founder of the Seth Harris Childhood Cancer Foundation, will be joining us to share her personal experience with ALL. Let's start with a few facts about childhood cancer. Cancer is the leading killer of American children. Each day, an average of 7 children are dying of some form of cancer. There are fewer than 8 drugs developed to treat childhood cancer. Doctors are using the same treatment with few, if any, changes that existed in 1970. In 2015, the National Cancer Institute budget was $4.93 billion, and only 4% of that went to pediatrics. More than 90% of childhood cancer survivors will have a significant health problem because of treatment or cancer itself. Okay, let's talk a little bit about ALL, what it is and what it affects. ALL begins with immature white blood cells called lymphocytes in the bone marrow. It can progress quickly. This type of cancer mainly affects the bone marrow and the blood, which can lead to spreading to other places. ALL can affect the T cells or the B cells. T cell ALL most commonly affects male children older than 5 years. Diagnosis is usually made between 2 and 5 years for B cell. Signs and symptoms of ALL are anemia due to lack of red blood cells, weakness, infections more frequently due to lack of normal white blood cells, fever, nose bleeds, and easily bleeding or bruising due to lack of platelets. Diagnosis can be made from blood cultures, H&H, and bone marrow biopsy. A chest x-ray will be taken to see if lymph nodes are swollen, and a lumbar puncture test may be done if the leukemia is suspected to be in the nervous system. Once a child has been diagnosed, it is important to remember their immune systems will be very fragile. They do not need to be around large crowds or anyone who has flu or any type of illness. The most important thing to remember is to wash hands frequently. Okay, so now I'm going to demonstrate proper hand washing technique. You're going to turn the water on. Make sure you have lukewarm water. You're going to thoroughly wet your hands from the wrist down. Okay, once you have your hands wet, you get 1 pump of soap. You're going to palm to palm. Friction in the warm water helps prevent germs. Okay? Then you're going to overlap. You go in between the fingers. Do the same on the other side. And now the nails. When you rinse, you want to hold your hands down. Okay. Now that you have all this soap off, you let the water drip. Never shake your hands. Then you grab your towel and you dry from the wrist down. And use your towel to turn the faucet off. Okay? It's also useful to have Kleenex. You want to take the Kleenex and cough or sneeze directly into the Kleenex and then throw it immediately away. After you do this, it would be a good time to wash your hands with soap and water. If you don't have soap and water, alcohol-based hand sanitizer can be used. You want to use 1 pump and do the same method as if you were washing your hands with soap and water. Never blow, just let it air dry. Once it's dry, then you can touch surfaces. You also want to have disinfectant wipes, and you want to use disinfectant wipes to clean everyday common surfaces the child touches, such as toys. You're going to clean the toys thoroughly, especially if it's a small child, because small children always want things in their mouth. Use 1 wipe for each item. You can also use the disinfectant wipes to clean doorknobs, to the front or back doors or the bathroom, TV remotes, cell phones, kitchen counters, anything the child touches a lot. Bathing is also important. The child needs to bathe every day. After the child bathes, you want to monitor sites where they have tubes, catheters, or ports for redness, swelling, or irritation. If any of these signs are present, you want to contact the medical provider immediately. If the child's inpatient, you want to let family and friends know to keep visitation at a minimum because of their immune system being so low. Also, it's not a good idea to send fresh flowers because fresh flowers carry germs. There are plenty of resources for childhood cancer. For nursing students like myself, our Rosdale is always a good source. For parents or the public, you can check the American Cancer Society website or the Seth Harris Foundation website. Now that I've given you a pretty good idea of what childhood cancer is like, let's hear from Miss Harris. At this time, I would like to introduce Miss Harris. She's the mother of Seth and the founder of Seth Harris Childhood Cancer Foundation. And thank you for being on the video with me.
Thank you.
Okay, I have a couple questions. The first question is, as a mother, what were some signs and symptoms that let you know something was wrong with your child?
The only symptoms he had was stomach related, and it started out just his stomach hurting for a few days, and then one day he would vomit. One time, that would be it. Next day he'd have diarrhea, and then on the third day, when you think, okay, maybe it's a virus, let's go to the doctor, then he'd be fine. And it just did that for weeks. And then we went to the local doctor and got blood work done, and they said it was H. pylori. So we got treated for H. pylori until we finally went to Batson's ER, and that's when they did further blood work and found that he had leukemia.
And Seth received all treatment at Batson?
Yeah, all of it but Batson.
Okay. How old was Seth when he was diagnosed?
He was 10. He had just turned 10 in May, and then we got a diagnosis in July.
As being a young child in school and having sports and friends, how did the diagnosis affect his social life?
Well, he hated school, so they're finding out he didn't have to go and start 6th grade. He was
enjoying
5th
that.
grade. He was elated, but then it started. He found out they were going to parties and all that stuff, and he couldn't go because he wouldn't have any, cells. His immune system was shot from the chemo, so it started affecting him eventually, and so he was just. I guess he got a little depressed, but not as bad as you would think because he was an outdoors guy, and he'd just say, "Well, let's go hunting." He would cheer himself up. He was great about that.
How did the diagnosis affect your family as a whole? Like, since you had to take care of a sick child, were you able to work? Was your husband able to work? And did you have a good support system?
Yeah, Chad was working. He works up here at the industrial park, and then my boss, which I've been with him since 1990, and this was 2007. So my boss was wonderful. He's more like family anyway. And so he's just, whatever you need, however much time you need to take off, do it. And, when you can work, fine. But we stayed, when he was first diagnosed, we had to stay a solid month because he had to receive the chemo every day. And, of course, they had to get his blood work down. His white cell count at diagnosis was 259,000. So as soon as they started getting it down and started hitting him, with the harsh chemos. So we stayed that month, and then it was just, we'd go back usually once a week unless something, come up.
Mm-hmm. When you found out Seth had ALL, did you do your own research, or did you just rely on what the doctors were telling you?
Yeah, the doctors told, don't look, don't Google it. It's going to, be terrifying. But my sister had gotten me a few books about childhood cancer. And then I did research, and CaringBridge was wonderful because I would find kids that had what Seth had and were around that same age and, ask their mothers questions. So it was great having that. At that time, Facebook wasn't all that popular, so it was CaringBridge.
What would you tell other parents who are experiencing a diagnosis of cancer in a young child?
Be diligent. I know Batson gave us this road map, and it was just this 3-ring binder that we were to keep up with everything. Compare the blood work, know what your child's normal levels are. know what they're supposed to be getting each and every time of treatment, because there was one time we found they were hanging a bag and we were like, no, he's not supposed to get that today. His white count wasn't up enough, and they went and looked, and sure enough, they were like, you're right, he's not supposed to be getting anything today. So we were just there to get a checkup. So
be
just
very
be on
involved
top
in
of
the
it.
treatment
Yes,
plan.
yes. Don't just let them, because humans err.
Yes, ma'am. Okay. Would you like to tell us about the foundation that you started in Seth's Remembrance?
Yeah, we started that. Me and my sister and a friend started it just because I didn't want to sit around and just be completely depressed, and I wanted to do something towards childhood cancer, and I wanted to do something to help the hospital. And so we started out with we wanted awareness, and people know that September was National Childhood Cancer Awareness Month. And then we wound up, people wanted to donate, we wanted to have benefits and all that stuff. So now we're able to actually help local families. And then anytime the hospital lets us know, I stay in touch with 2 child life specialists and one of Seth's favorite nurses. And they just let us know what they need, whether it be Kleenexes, they need that refurbished, if they need snacks, if they need t-shirts, underwear, toothbrush, toothpaste, whatever the need is, we try to get it. And we've been great and successful with our community, always coming together and doing that. This church will do, and that school will do, and we go with usually an abundance of whatever they need.
Yes, ma'am. Well, thank you for letting me
You're welcome.
interview.
You are welcome.